You're very welcome out to the study where I am sitting in the dreaded dental chair, although I feel like I'm about to get a massage in this big chair. I'm joined by Dr. Tom Linehan from Seapoint Clinic in Blackrock, and we are about to bust some of the myths when it comes to dental care, and we're also taking your dental questions this morning. Good morning to you, Thomas.
Good morning,
Thank you very much for joining us.
It's a very comfortable dental chair, isn't it?
It's a very big dental chair. I feel tiny in it.
Comfort is everything, isn't it?
And I'm not a fan of the dental chair, but I know you guys handle that very well, and we'll get to that in a moment.
Thank you.
Can we talk about some of the myths first of all? Because losing teeth, first of all, is probably the biggest one. Losing a back tooth doesn't matter. We've all been told that at some point, haven't we, by someone?
Yeah, of course. Some people think that losing a back tooth is something that isn't an issue. Losing any tooth is a problem. There's a thing called the domino effect, that if you lose one tooth, it can cause you to be much more likely to lose the teeth around it. And as you lose your teeth, you lose the ability to chew the foods you like. It makes more likely that you'll wear your teeth down and that you'll have problems in later life. Yeah. So losing a tooth is a big issue. The only way to stop a tooth from being lost is make sure that you get things checked out and dealt with early.
Okay, it's obvious though it's going to change the structure of your face, isn't it? I mean, that support is no longer there.
That's dentistry's secret. This is something that dentists never spoke about in the past because there was nothing that they could do about it. When a tooth was lost, you lost the bone of your jaw underneath, and when you lose the bone of your jaw, your face will change.
You might talk us through this image on the screen now, Tom.
This is a depiction of somebody who's lost teeth over time, and losing a tooth is one thing, but the reason that we have gums and bone is to hold on to our teeth, and when they're gone, the bone of your jaw literally shrinks away.
Amazing, that aging process, isn't it?
It's incredible. So if somebody gets, for instance, a denture made, it might be comfortable initially, but over time, as the bone shrinks away and their face changes, it becomes more and more uncomfortable to wear a denture and more difficult to eat food comfortably.
Yeah, just day-to-day basic things, I suppose. Sugar, let's talk about sugar, because one of the myths, I suppose, is it's only the sugar in sweets, cakes, fizzy drinks and chocolate bars that will harm our teeth. That's not true.
This is so tough for mums. It really is. There's sugar in everything nowadays. Any kind of processed foods, yogurt, processed cheeses, even fruit juice. People think that fruit is very healthy, and in general it is, but fruit juice is concentrated sugar of fruits. So if young children are drinking lots of fruit juice very regularly, it can impact their teeth very significantly, and children who have what their parents think are healthy diets can end up with lots of decay in their teeth.
If we eat lots of fruit, we're trying to be healthy and we have a lunchbox full of fruit going to the office during the day, is there any way without brushing our teeth to kind of neutralise all those sugary acids in our mouth?
Well, the main advice is to try and limit sugars to meal times.
Okay.
Everything is about how often per day that you take sugar in your diet, and teeth can handle about 4 times a day. So if you're having sugar, the sugar in breakfast cereals and jams and fruit juices. So if you try and limit sugar to just in your meal times, that's best.
Okay.
And the other thing is, if you want to snack, none of us are angels. Try and snack on something that's sugar-free. Popcorn, any kind of crisps. Those things are great to snack on because they don't have sugar in them, and they don't cause the problems that sugary snacks do.
So we need to rethink it. Some questions from our viewers this morning, Tom. My daughter had her teeth cleaned, but they're still yellow. That's from Liz.
There's a natural variation in how teeth look. Some people are born with whiter looking teeth, but there's no such thing as a white tooth. All teeth are a little bit yellow. There are things that can be done about it. Maybe if she's getting close to her 18th birthday, that a nice birthday present might be a tooth whitening voucher or something like that.
Okay.
If she's particularly worried about it. But for younger kids, you tell them it's perfectly natural. There's nothing to worry about.
Okay, there is nothing to worry about. Someone else has an interesting question, and I'm guessing a lot of viewers will be interested in this. I'm on warfarin, which I think is a blood thinning drug, isn't it? And I need to get a tooth pulled. What should I do? I'm terrified.
Oh, it's frightening for anybody. Of course, frightening for anybody who has to have a toothache, but it's so easy nowadays. The main advice is that anybody who's on warfarin or aspirin or any of these modern blood thinners is don't stop taking them. Do exactly as your doctor tells you, and we're used to dealing with these problems all of the time. So come in, talk to us. We'll design a plan that makes sure that it's as safe as can possibly possibly be.
Brilliant. Okay. You do have a lovely environment in there, and you're well known for dealing with people with nervous dispositions and wusses like myself, I suppose.
I remember you well.
Now, we have something special for viewers this morning. If you have always dreamed of having that perfect smile and getting your confidence back and your self-esteem and everything, this morning we are giving you, the viewer, the opportunity of a lifetime to have a dream smile. And you know, it's never too late. To enter, you can just email us a picture of your face showing your teeth. That's very important, along with your name, your age and your address. And the email address is smilemakeover@tv3.ie. There's all the details on the screen. And do that before Friday, February 7th. So Dr. Thomas Linehan from Seapoint Clinic, thank you very much,
thank you very much
for joining us this morning.